and member secretary student mentoring committee, and she has contributed excellently to the academics and has received awards for various paper presentation and has made major publication in national or international journal of review. Thank you, ma'am, and welcome to the panel and Gwalior. And we have, and as I was told, she has her house in Gwalior. Her parents also live in Gwalior, so it has been a homecoming for her and enjoying the घर का नाश्ता मिलिए, खाना नाश्ता मम्मी के हाथ का, that was good. Okay, and we have Dr. Nilima Ranjan, your own from GR Medical College, MD Microbiology, Professor and Head, and she's area of interest are again clinical microbiology and medical education, and she is also published highly in the national and international journal. So thank you, welcome all of you. Thank you, Dr. Nilima, Dr. Prabjot and Bhatia sir. So we go on to our presentations today. The topic is the future of assessment. Now, why do you think about future of assessment? It has become necessary or essential because we have migrated from the traditional teaching to the competency-based medical education. And to assess the competency, obviously we need a different kind of exposure, especially not only in the undergraduate but mainly in the postgraduate teaching as well. So we'll be touching various facets of, we need to make it simpler, let's not make too much of terminology, but we have terminology. Okay, so assessment on the workplace means you have to be assessed where you are working, whether you are capable of delivering something or not. So how to assess your work on the workplace itself is a big question. That is what is known as simply workplace-based assessment, and Dr. Rakesh Bhatia will be speaking a few slides, a very brief presentation on what is meant by the workplace-based assessment and what are the challenges. Over to you, sir.
On the competence of the individuals, but over the year it has been realized that it doesn't actually reflect what they actually do in the practice. So our training has to be, can you move it forward? So this is the classical definition by Norsini et al., which is workplace-based assessment is a method of evaluating the performance of the training in a real clinical environment, using a series of observed tasks and structured feedback. And this together, these two things provide a valid and a reliable formative picture of the trainee's competence and of his professional behavior. So there are three cardinal components here. There is direct observation, and this direct observation is conducted in the workplace, and very crucial is the provision of feedback. The traditional methods assess competence. So, on the other hand, the WBPA assesses performance, and that too in an authentic situation. Before we go to this slide, this is the Miller's classical pyramid of the medical education. The process of learning, the base is formed by the knowledge. The candidate knows. The second level is that of acquisition of knowledge and its application. Then he knows how to use this knowledge, and third level is that of he shows how it can be done in controlled circumstances, and finally does. He uses this knowledge independently to perform a task, and that too he has to imbibe it into his own clinical practice. So this was the Miller's classical pyramid, and the WPA. Quite often this emphasis on fancy cases in the examination, very exotic kind of situations which are there in the artificial environment of the examination, but the emphasis in the WPPA is to talk about what is relevant in the day-to-day clinical practice, and therefore it's conducted in the real atmosphere, and it is content and context specific. And this has to be aligned, the actual working has to be aligned with the learning process. So the process of learning is equally important as compared to what is done in the examination. So process and the outcome both have to be aligned together. It's not merely the outcome which is important, but what you do along with your journey in the learning process is important. And very important is that it encourages reflective practice. Now this reflection is not only on the behalf of the candidate, but also on behalf of the assessor or the trainer. So WPBA encourages reflective practices. Now once there is direct observation, there is a contextual and empathetic feedback from the assessor. And this leads to reflection both on the behalf of the trainee. He reflects what I did wrong, what I could have done better, and also on the part of the assessor or the trainer. And the foundation of the workplace function is that is based on the feedback. This feedback is extremely crucial for the developmental journey of the candidate and also of the program as a whole. What are the important tools of this workplace-based assessment? It is not a replacement for the conventional teaching. The conventional assessment is also equally important, and this acts as a complement to it, and there are various methods by which you can do this. You can document the work done by the trainees through a logbook. There can be direct observation of the performance during clinical encounters. This could be done through by many clinical encounters exercise, or could be direct observation of the procedural skills, also acute care or assessment tools and CWS. The classical discussion of the individual cases also figures in these tools for WPA. Then the feedback is extremely crucial. It's a multi-source feedback. It comes from your patients, it comes from your colleagues, it comes from your peers, and also comes from your trainers. And this also is conceptualized in the form of many PAT and also patient satisfaction questionnaires. So all these tools, they are not only standalone tools, but they can also be documented in the form of a longitudinal process, and which makes a portfolio and which assesses an overall picture of the experiences and the progress of the trainee. So what is the utility of this workplace-based assessment? It is extremely valid because it works in the real time in the workplace, and its reliability is tremendous because there are many assessors assessing the candidate over a significantly long period of time. There were 6 to 8 encounters in a year, and which gives you an acceptable reliability. The acceptability is good because it's already sensitized the students and the faculty in an environment of mutual trust. This trust is very crucial between, because there are quite often misgivings about, because the trainers also are the assessors. Your teachers also are the assessors. There sometimes hesitation on the part of the teacher because it also reflects on the teaching process. Its acceptability is good because it depends on sensitization and mutual trust, and feasibility has been quite frequently proven in atmosphere in various medical institutions across the world, and many of the institutions across the country in our own part. There are several challenges to implementation of this workplace-based assessment, and the sensitization of student and faculty, of course, is crucial. But what is the biggest roadblock is faculty training. The faculties are the most reluctant to join on the bandwagon of the workplace-based assessment. There has to be clarity on what is to be assessed and what are the expected norms, because this is an extremely subjective process. Unlike MCQs and other methods of assessment where there is inbuilt reliability, here there is a lot of subjective component in the implementation, and therefore the faculty training, faculty sensitization and their motivation is extremely crucial. And what is very important is that they should be giving effective feedback. It's an empathetic feedback, it should be effective, and this is an art which you learn across your own developmental journey as a faculty and an assessor. Feasibility demonstration is extremely crucial. Once other institutions have done it, you feel you can also do it in your own institution. It has to be done in an environment of mutual trust. There is a lot of misgiving about the student-teacher relationship, even in the medical institution. What used to be very cordial atmosphere in the past, today has seen a lot of changes now. This distrust between the faculty and the students, and what the students expect and what they want to achieve, also quite different today what it used to be 3 or 4 decades back. And extremely crucial is that it should be included in the regulation process, and unless it's included in the regulation, it cannot be very effectively implemented. So these are several changes to implementation of the workplace-based assessment. since these competencies that we are going to assess, they are developing across the journey of the training, across several months and years, and therefore their assessment also has to be developmental. Now the beauty of the WPBA is it has both. There is a developmental trajectory and also there is authenticity. And this authenticity comes from being conducted in a real life, real time environment in the wards, in the OPDs. And this assessment not only tells us what the trainees have done, but also tells about the quality of their learning. Thank you so much.
Thank you, sir. Thank you for presenting the. It's a very big topic, so it's very difficult to compress it in 5-7 slides, but you have done it beautifully. So I think, as sir said, there are 3 major components of the work.